I'm pretty sure I can help you more with movement disorders right here in the park than you could get at the Mayo Clinic. More help than the Mayo Clinic right here, because this is based on 3,000 years of history and practice using the tools that they had available. You understand that pharmaceuticals have only been around for 100 years? And in 100 years of use, they have become the third leading cause of death. That might be some sort of record. So hands and plants, we're going to focus on hands in treating movement disorders, which is any type of breakdown in movements, any movement disorder where we're trying to hold still and our head is actually moving, or we're trying to grab a coffee. And this has been tested. It has been tested over time, and it has been tested in a randomized clinical trial. And there's actually a stripe along our head that they use for movement disorders. It begins just above the temple at the hairline and goes back to just behind the very tippy top of the head. So right at the very tippy top is governing vessel 20, and this line goes from here to here, like this. And so all we do is we start here and we massage back. I'm going fast. Take your time with this because you're caring for yourself. And you'd come up to the peak, and then you'd come forward to GV20. And then there's 4 points around that: forward, back, side, and side. And so you'd hit the front and back, and the side and the side. And then you come back to the base of the skull, right under the skull, and you'd massage there. That's gallbladder 20, wind pool. Wind is overwhelmed, so kind of brings things to a calm, to a stillness. And then there's 3 points on the legs. So directly behind the knee, right in the middle of the bend of the knee is bladder 40. And then right at where the calf muscle turns there, push into the bone. And then you can do both these at the same time. This is like, I think the best visual or feel to it is an eagle landing on a branch. All of this crazy motion coming whoosh to stillness, and all the coordination that is required for such an amazing feat. Do both sides, left first and then right. The next point is right behind the medial malleolus, that bump on the ankle. Right behind here is kidney number 3. If our flexibility allows, we can do both points at the same time. And that, of course, is safe, and you'll get more value and more benefit with movement disorders than going to the Mayo Clinic.